A lovely evening and thank you for joining us. This is Times News with me, Edita Soko. We begin with the headlines. Human Rights Defenders Coalition appeals to the government to strengthen democratic institutions through adequate funding. The Department of Disaster Management Affairs plans to commence assisting hunger-stricken families in December. And Ministry of Health launches guidelines on the use of HIV pre-exposure prophylaxis or PrEP. We have these and other stories to stay with us. And our first news item tonight, the Human Rights Defenders Coalition, HRDC, has appealed to the government to strive to strengthen democratic institutions through adequate funding. HRDC made the call in commemoration of the International Day of Democracy, which falls on September 15 every year. Wezi Gausi reports.
HRDC chairperson Gift Trappens says the adequate funding should go to institutions like the Anti-Corruption Bureau, Ombudsman Office, National Intelligence Bureau, the Judiciary, and the Malawi Electoral Commission, among others. He says it is pathetic that these institutions in the 2021-2022 national budget were given 39 billion kwacha to share, which is too little for them to meet their mandate.
These are institutions that plays a very crucial role in the promotion of good governance, in the promotion of accountability, in the promotion of democracy. Because if we are promoting accountability or good governance, the rule of law, it means that we are promoting democracy.
Minister of Finance spokesperson Williams Banda says they have noted the call to increase funding to such institutions, but as of now they cannot do anything as the budget was already passed.
Cannot change anything unless it goes back to Parliament for amendments. We appreciate the concerns, and the government will ensure that the institutions that does the democratic principles carry out their objectives and obligations without any shortfalls.
The commemoration was under the theme A Call for Active Citizenship in Malawi's Democracy.
Now, Mzuzu City Ward councillors have decried a lack of transparency at the council, alleging they are not given financial reports on how developmental projects are being run in the city. Mzuzu City Deputy Mayor Gift Nyirenda observed that the problem is, among others, due to a lack of coordination between the council secretariat, the councillors, the members of parliament for the city. Patience Lunda with the details.
Nyirenda disclosed this during an interface that the Catholic Commission for Justice and Peace, CCJP, organized with ward councillors, the MP and council officials. Nyirenda thinks there is need for all key players in development to work together, but unfortunately that is currently not happening.
We are looking for a report in terms of how we have used the money and the like. That one has been a general concern for each and every council and each and every ward.
Speaking after the interface, CCJP Executive Director from Mzuzu Diocese, Felix Manda, observed that issues of accountability are a challenge at the council, hence the need to push for easy accessibility of financial reports.
Budget processes, budget tracking, and even expenditure is not actually verified by the residents of Mzuzu. So most of the activities or programs are done by the Secretariat alone.
CCJP has embarked on a project in councils aimed at enhancing accountability and utilization of resources, a move which will see wards receiving equal financial support for development works. On his part, Nchangautua East Ward Development Committee Chairperson Amon Nyasulu said a lot of projects have stalled in the area because they are not aware on how funds are being utilized. CCJP is also working with Zomba, Doa, Blantyre, Mangochi and Ncheu councils on similar projects.
The Department of Disaster Management Affairs, DODMA, plans to commence provision of humanitarian assistance to hunger-stricken families from December this year. The latest Malawi Vulnerability Assessment Report, MVAC, indicated that about 1.5 million people are likely to face hunger from January next year. DODMA spokesperson Chipirilo Kamula says consultations are underway with different stakeholders to develop a lean season food insecurity response plan. Audrey Gabalamula spoke to Kamula.
We are having some consultative meetings with various stakeholders. We have met with the World Food Program, and this morning we also held a virtual meeting with the Food Security Cluster, which is some grouping of government and as well as non-governmental organizations involved in issues of food security. And we hope to finalize the plan very soon. We have made some good progress in terms of the consultations. All things being equal, we expect to start implementing the plan even earlier. We could start even in December.
That is Chipirilo Kamula, who is the spokesperson of the Department of Disaster Management Affairs at DODMA. The Minister of Homeland Security has urged chiefs in the country to spearhead the fight against trafficking in persons and smuggling of migrants. Richard Chimwendo Banda made the remarks on Tuesday during an orientation of senior chiefs on the issue in Blantyre. Thomas Kacheri has more.
The minister said for the country to end such criminal activities, Malawians need to work together. He acknowledged that human trafficking is on the rise in the world, including Malawi, which is mostly being used as a transit country. Chimwendo Banda therefore warned that the law will not spare anyone found aiding the malpractice.
We find out that chiefs are the biggest stakeholder. Those are the people that are staying with the people in the community, and they're the ones who can first trace what is happening and connect very well with our ministry. That is why today we are meeting all senior chiefs in the southern region, just to, one, empower them with knowledge, but also establish linkages with them so that when it happens out there, we should be able to work very fast with them.
Senior Chief Chikumbo of Mulanje District said the training was fruitful and will help them as chiefs to fight crime. Meanwhile, Director of Chiefs Administration in the Ministry of Local Government, Charles Makanga, commended government for training the chiefs who are lacking knowledge on trafficking in persons.
The chiefs are the ones who are the custodian of the people in their areas. So this orientation is very, very important to chiefs so that they should understand the government policy and even the government act, so that when they go back, they should be able to work hand in hand with the government ministries or agencies.
55 chiefs from the southern region participated in the orientation, which in the long run will help in curbing trafficking in persons and smuggling of migrants in the country.
The Ministry of Health has launched HIV pre-exposure prophylaxis or PrEP guidelines, as well as a communication and advocacy strategy that stipulates the use of the drug. The drug is taken orally before one is exposed to the virus to prevent them from contracting it. Minister of Health Kumbizeka Ndodo Chibonda has however stressed that the use of tablets should come as a third option, with the first and second options being prevention and condom use respectively. Matthews Kasanda has this report.
The two documents were launched in Lilongwe on Wednesday. So far, the ministry has reached out to about 1,000 people across the country who have been taking PrEP. The drug is given to a person who is at high risk of contracting HIV, and it is required to be taken once every day. Chibonda says there's a need to spread the message to more youth, including schools.
PrEP basically means pre-exposure prophylaxis, preventing one from getting the disease. So these are all the options which are available, but most of the youth, maybe they are not aware of these things, or they, because youth are youth, most of them do not go to the hospital to ask about these options. So that is why I'm saying we need to go out and reach to them.
U.S. President's emergency plan for AIDS relief, PEPFAR coordinator Fumi Adesanya says the U.S. government has been working with the Ministry of Health by providing financial and technical support in the implementation of the PrEP program.
We're excited. A lot of countries in the region have really been progressing with PrEP. We know that it works. We know that It's really something that young people are looking forward to and accessing. So especially looking at adolescent girls and young women, our DREAMS program, which is our prevention program to reach adolescent girls and young women, and working with commercial sex workers is just an opportunity to provide an additional tool in our toolbox to really close the tap on HIV prevention.
The Ministry of Health has indicated that PrEP can be accessed in all district hospitals and health centers in the cities.
Nguludi Mission Hospital has started an outreach vaccination initiative to reach out to people and offer flexible options for COVID vaccine uptake in villages. Nguludi Mission Hospital Senior Medical Officer Maggie Kumbanywa says this is to help the communities from villages around the hospital in Giradzulu receive the COVID vaccine at their convenience. More in this report by Luene Nimpasa, read by Mandi Bondani.
This was said at a function in Giradzulu where the Catholic University of Malawi donated hospital equipment worth about 2.5 million kwacha to the hospital, supporting the COVID fight. Speaking at the handover ceremony, Kumbanywa says the hospital started inoculating communities around Nguludi with COVID-19 vaccines right in their villages to accelerate the vaccine uptake and protect more people.
In terms of vaccination, we know that a lot of people had misconceptions of the vaccine because a lot of people were attaching negative comments. Currently, we're sending our health workers into various villages to vaccinate people, and turnout is good in some areas and it's kind of poor in some areas because some areas haven't received adequate information on the vaccine. So we're hoping that when we continue giving good information and advising people on what the vaccine does, the turnout will be good and a lot of people will be vaccinated.
Catholic University Registrar Francis Vincent Koma says as a corporate social responsibility, the university felt obliged to give back to the hospital.
As Catholic University of Malawi, we have been in good partnership, in good relationship with the St. Joseph Ngudi Hospital. We felt and got compelled that we have to assist St. Joseph Ngudi Hospital, much as we have also assisted other people out there in other districts when we had floods in Malawi. So it is our corporate social responsibility to reach out to such people and help them with their needs.
The Ministry of Health introduced the Outreach COVID vaccination initiative to reach out to as many people as possible across the country.
Meanwhile, there are fears that some batches of the COVID-19 vaccine, especially AstraZeneca, may expire because of low uptake. The expiry date for the vaccines that the country received recently is reported to be September 30, 2021. Rebecca Jimjeka has more in this report read by Matthews Kasanda.
According to the Ministry of Health data, by Monday this week, the country had 87,805 doses of the AstraZeneca vaccine that needed to be administered before the expiry date. The country also had 62,095 Johnson & Johnson doses to be administered before expiry in November this year. Ministry of Health spokesperson Adrian Chikumbe says the ministry is doing everything possible to finish the vaccines. He says the challenge that the country is facing is the misinformation about the vaccines. Health expert Maziko Matemba has described the low uptake of the vaccine and the expiry fees as worrisome. Minister of Health Kumbize Kandodo Chiponda on Saturday bemoaned the current low uptake of COVID-19 vaccine in the country. She cited the southern region of the country as the lowest uptake of vaccines. Chiponda further called for massive awareness of the importance of the vaccines by every stakeholder. Currently, Malawi is at level 2 of the pandemic with progressive downward trend in new cases, deaths, as well as increased recoveries.
The Minister of Education, Agnes Nyalonje, says her ministry is planning to establish a national education radio station as one way of expanding access to quality education. Nyalonje said this on Wednesday in Lilongwe during commemorations marking International Literacy Day under the theme Literacy for All, a breakthrough to socio-economic development amidst the COVID-19 pandemic. She explains.
we're wanting to look at how we can do something massively through that platform, because an added advantage of it is that you are aware that the country has a huge challenge of education infrastructure. So by opening up such a platform and resourcing it adequately, and we're looking for resources, it's not that resources are already sitting there, but we believe that if we can do that, it will take the pressure off the need to provide the massive infrastructure that the education sector needs. We still need infrastructure, but the pressure should reduce somewhat. And it will also help us to improve the quality of what we offer, especially in rural areas.
Vice-Chancellor of the Lilongwe University of Agriculture and Natural Resources, Luana, has urged members of staff to come up with research publications that will promote global recognition of the university. Vice-Chancellor of Luana, Emmanuel Kaunda, made the remarks on Tuesday when the university was awarding some of its members for publishing research journals and books in the 2019-2020 academic year. Blessings Mbinganjira reports.
Kaunda expressed worry that out of 200 university members of staff, only 60 came up with curated journals. The Vice-Chancellor urged all faculties at Luana and Natural Resources College to borrow a leaf from their counterparts and use publications as one way of enhancing research at the university. Director of Research at Luana, Sam Katengeza, admitted that they have not done enough in research publications, citing lack of proper resources as the major contributing factor.
This is one reason why we thought of bringing them together for this award, so that they can feel motivated and energized to publish in good journals, as this is one way of not only enhancing the impact of the research that we do, but also promoting the global recognition of our young university.
The award-winning members received $100 each.
You're watching the news on Times TV. We'll be back with more shortly.
If there's one thing that all soaps do, it's wash. From buckets to basins, bathrooms to streams, and everything in between.
All soaps wash.
Yes, but Protex is different. Its reinvented formula with flaxseed oil boosts your skin's natural anti-germ defenses by 10 times more, protecting you against 99.9% of germs. So what keeps us healthy?
Protex!
Good health starts here.
We all start differently, but we can all start with the strongest protection. Because some start early, others start late. Some from little homes, others from big ones. Some start together, or all on their own.
It doesn't matter how you start, as long as you start strong. With new Colgate Maximum Cavity Protection. Now with fluoride plus arginine for 4 times more strengthening power. So that you can give them the strongest start to their day. Colgate. Start strong, stay strong.
Mona Malawi anzanga. Nkhondo yogonjetsa COVID-19 ndi ya wina aliyense. Tili limodzi. Ine ndinasankha kulandira katemera wa COVID-19 atangoyamba kuperekedwa. Chifukwa monga namwino, moyo wanga, umoyo wa odwala amene ndimawasamalira, abale anga, ndi dera langa, ndi zinthu zomwe ndimazika pa mtima panga kwambiri. Katemera wa COVID-19 anditeteza ine ndi ena omwe analandira katemerayo ku chiopsezo choti tingadwale mwakayakaya, kugonekedwa mchipatala, kapena kutaya moyo wathu chifukwa cha COVID-19. Kulandira katemerayo kutithandiza kuthana ndi mliri wa COVID-19 limodzi.
Ziwani zambiri za katemerayo ndi kupanga chisankho cha nzeru. Sankhani katemera, tetezani tsogolo.
Welcome back. The Women Caucus in Parliament on Tuesday visited the Kasungu South East constituency where they expressed concern over a lack of support in maternal health services. The women legislators interacted with community members and learners at Kanjoka Primary School. Weze Gaosi has the detail.
The women visited Pitilani Cheni, who is nursing twins of her late daughter who died while giving birth. Changanamuno says the trip was part of the routine activities the forum has planned to interact with its members in their constituencies.
And in Parliament, we are going to advocate for better services so that we see that our women are getting the services that are required. At the same time, we also want to encourage the women so that they go to hospitals when they are pregnant.
Minister of Health, who is also Member of Parliament for Kasungu South East constituency, Kumbize Kandodo Chiponda, says the visit was to empower women parliamentarians despite their political affiliations. Chiponda bemoaned the high dropout rate at Kanjoka Primary School.
This country has to develop. We need to keep our girl child in school. We need these kids to finish primary school. After primary school, they finish secondary school, and then they get tertiary education as well. Because these are the people who are going to develop this country. So we have so many initiatives, and one of them was this function which we had today. Because these lady MPs, they are mentors, they are role models for these young girls.
During the visit, the women donated assorted items to Kanjoka Primary School and to Ncheni.
Three police officers working at Rumpi Police Station under the Criminal Investigation Department and Burundian national Hassa Jama are facing accusations of assaulting an 18-year-old boy for allegedly stealing 2 carjacks. The victim, Boston Muhango, who works at a car wash premised at the Boma, claimed he was severely beaten up by Brave Gideon and the other 2 police officers and was taken to Rumpi District Hospital where he was admitted. Sam Galimira has the story.
Speaking in an interview, Muhango, who still has brushes on his body, said he was still feeling pain and was struggling to walk properly due to pains on his hip and knee joints. He, however, maintained no wrongdoing despite the torture he was subjected to. Muhango said the incident took place when he went to Jana's house to wash vehicles, where the accusations that he stole the 2 vehicle lift jacks were leveled against him.
Bige took me somewhere and started beating me up with a police officer. Later, they called their friends. He took me somewhere close to the bar, where together with police officers, they started beating me up again. Then we went to his house, where they beat me hard with metal rods.
When contacted, Jana denied beating up Muhango, while Gideon declined commenting on the matter. Rumpi officer in charge, Gerard Chiwanda, said his office has not received any complaint on the matter. However, Muhango's aunt, Monica Seremani, said the families want justice on the matter, arguing police officers are meant to enforce the laws and protect the rights of people.
Our thinking is that when somebody is suspected of theft, the police come in to enforce the rule and not to beat the suspects. Therefore, we want justice to prevail on the matter.
Commissioner of Police responsible for the Northern Region, Richard Luhanga, recently said he would not shield any officer from breaking the laws, saying the police always promote professionalism in their work.
Now, a 34-year-old woman, Fanny Kanyimbo, has delivered 3 babies at St. John's Mission Hospital in Mzuzu. This has caused both joy and bewilderment at the same time, as Kanyimbo is a single mother who already has 4 children to look after. Sam Kalimira reports.
Born on September 11, 2021 at St. John's Mission Hospital in Mzuzu City, the triplets have been named Faith, Peace and Rejoice and were weighing between 2 to 2.3 kilograms. Authority at the hospital said despite the mother being in good health, she cannot manage to produce enough milk for the babies and therefore extra milk could help the mother. During our visit to the hospital, the babies seemingly had not enough clothing. Fane tells us she needs support.
I need money to support my babies and start a business.
Her mother, Efrina Msachi, who is over 80 years old, said she is happy for the gift of the babies, but she is worried how they will take care of them.
We need food, clothes for the babies, and money so that she can start a business.
St. John's Mission Principal Nursing Officer Nancy Kamwendo said the babies need quick support if they are to reach 2.5 kilograms, a condition for their discharge from the hospital.
For that mother to have healthy babies, she needs adequate nutrition for her to produce adequate milk for the babies. But because there are 3 babies, the milk may not be adequate still. She will need a formula to top up with the breast milk. On top of that as well, she needs clothing for the babies and beddings. As you know, Mzuzu is very cold. Even now in September, it's still cold.
Fanny Kanyimbo comes from Nambo area within Mzuzu City.
And that's the news tonight, but before we go, the headlines again. Human Rights Defenders Coalition appeals to the government to strengthen democratic institutions through adequate funding. The Department of Disaster Management Affairs plans to commence assisting hunger-stricken families in December. Ministry of Health launches guidelines on the use of HIV pre-exposure prophylaxis, PrEP. Now remember, you can get more on these and other stories by visiting our website www.times.mw. You may like our Facebook page Times 360 Malawi, subscribe to 1895 and follow us on Twitter at Times 360 Malawi. Now remember to wash your hands regularly, observe social and physical distance, mask up and get vaccinated to prevent COVID-19. Please stay safe. You've been with me, Edita Soko.